Welcome to the Ryan White Planning Council's first public hearing for 2023. This public hearing was pre-recorded online through Zoom. If you can view and download the documents from our website at rwpchouston.org. I am Audrey Skeet Boyle Jr., Vice Chair for the Affected Community Committee of the Ryan White Planning Council. Also with us this evening is the Chair of the Ryan White Planning Council, Crystal Renee Starr, the co-chairs of Quality Improvement Committee, Tana Pradia and Pete Rodriguez, and Diane Beck, Council Coordinator in the Planning Council's Office of Support. The focus of tonight's public hearing is to recommend changes to the services funded by Ryan White Part A, Part B, and state services for the fiscal year 2024, which will begin on March 1st, 2024. But first, there will be a presentation on Project LEAP by Diane Beck, who is one of the facilitators of the program. Afterwards, Pete will explain the Quality Improvement Committee's how to best meet the need process, and then Tana will present the committee's recommendations for HIV medical and support services funded by Ryan White and the currently provided in Harris County and the surrounding area. Remember that everything discussed here will not affect how services are delivered now, but will impact how services will be delivered approximately 10 months from now in the year 2024. After the presentations, I will explain how you can give public comment regarding the information presented. At this time, I would like to turn the meeting over to the Chair of the Ryan White Planning Council, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you, Skeet, for the informative introduction. Good evening, everyone. I am Crystal Renee Starr, Chair of the Houston Ryan White Planning Council, and I am pleased to welcome you to our public hearing. I will briefly describe the history of the Planning Council and what it is we do and why we are here tonight. The Ryan White program is the largest federally funded program focused exclusively on providing HIV care for people who do not have sufficient healthcare coverage or the financial resources to meet the challenges of living with HIV. Ryan White fills gaps in care that are not covered by other sources. The Ryan White HIV/AIDS Treatment Extension Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting with each reauthorization to accommodate new and emerging needs, such as increased emphasis on providing life-saving and life-extending medical service for people living with HIV. The Ryan White program works with governmental entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A, funds are designed to serve metropolitan areas and are awarded to the chief elected official primarily responsible for providing health care in the geographic area. In the Houston eligible metropolitan area, that person is Judge Lena Hidalgo. In 2002, Harris County received over $26 million to provide services for people living with HIV in the 6-county area, which includes Harris, Fort Bend, Liberty, Chambers, Waller, and Montgomery counties. In 2007, the state asked that the Houston Ryan White Planning Council to make recommendations for Part B in state service funds. Part B funds are awarded directly to the state of Texas and are used to provide care for people living with HIV in a 10-county area, which includes the 6 counties named previously, plus Austin, Colorado, Walker, and Warden counties. In fiscal year 2022, Ryan White Part A, Part B in state service dollars totaled over $31 million. Again, Congress required that most of these funds be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately half of the 30,000 people living with HIV in our area are using a Ryan White funded service. By law, the council is responsible for determining the number of individuals in our area who are living with HIV, assessing the needs of the HIV community, establishing a comprehensive service plan, setting service priorities and allocating funds, assuring that services are sufficient to meet the future needs of the changing epidemic, assuring the appropriate services are available to meet the needs of the underserved and underserved women, children, infants, and youth. Assuring access to services for those who need substance use disorder treatment, and accessing an administrative mechanism which procures services and disperses funds. The Planning Council falls under the Texas Open Meeting Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in a hybrid format, which gives you the option of attending in person or virtually. The council meets on the second Thursday of each month at noon. So for more information, call the Houston Ryan White Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information will be repeated for you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. That means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicare or Medicaid benefits before they are eligible to have Ryan White monies paid for primary medical care. There are also income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means that an individual with a yearly income of $43,740 or less will be eligible for assistance, providing all other avenues of coverage have been exhausted. The same guidelines apply to a single parent with one child, would be $59,160 or less. The service categories to review this evening includes those that are funded by Ryan White Part A, Part B, and state services. Examples of some of the services which the Ryan White program funds are allowed to provide include outpatient primary medical care, medications, oral health care, mental health services, and assistance with health insurance premiums, co-pays, and deductibles. The purpose of tonight's program is to inform the public of recommended changes to the local service category definitions in order to get feedback from consumers of Ryan White funded services and allow others as to how the recommended changes will affect the ability to receive medical care and supportive services. Community input is not only necessary, it is vital to all planning council processes and encouraged at every level. At this time, I would like to introduce our next speaker, Diane Beck, Council Coordinator in the Office of Support. She will present information about the Planning Council's training program, Project LEAP. Diane.
Thank you, Crystal. Hello, I want to talk with you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The name of the program is Project LEAP. LEAP stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start at the end of July and the program is free. But the expectation is that students participate in one class a week for 17 weeks, and they come to class prepared to listen and engage with the presenters and with one another. Project LEAP is unique to Houston and is only offered to 30 students once per year. The goal of the program is to provide skills so that graduates use these skills to become active and effective participants in the local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group. Graduates help shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, social workers, consumers, and others to design services. If you are a person living with HIV, or you have a friend or family member that is challenged by HIV, you are a perfect candidate for the class. So how does Project LEAP work? Classes are held on Wednesdays for 17 weeks. 15 students participate in the morning class, and 15 different students participate in the evening class. Each is about 4 hours and includes hands-on activities, group projects, and field trips. Guest speakers are experts in their field and enjoy sharing new and updated information with the students. What will you learn? As you can see from the long list on the screen, some of the topics covered in class include HIV 101, the history of HIV in the Houston area, tools for designing and funding services, leadership training, and much more. Class participants learn valuable skills, including meeting facilitation and how to use Robert's Rules of Order. If you don't know what that is, we will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings with role playing. We bring in expert speakers, and there are hands-on activities, class projects, and again, several field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or those who are affected by HIV either personally or professionally, and who can meet the class expectations in terms of attendance and participation. So what do you get out of Project LEAP? You get knowledge and skills that will help you advocate for your health as well as the health of others. You get an extensive binder of information with easy to read materials about HIV. You get access to experts and mentors, as well as some new friends who share your passion and concern for the issue. Most of all, you get the opportunity to make a difference for people living with HIV. So how do you apply to be a Project LEAP student? You must submit a written application before July 1st. We will call and set up an interview, which can be done in person or virtually, depending upon your comfort level. Classes will be hybrid, so students can choose if they wish to participate in person or virtually. The class will begin in late July and end in mid-November. To find out more information or to apply, go to our website at rwpchouston.org, or you can call 832-927-7926, or you can email me at diane.beck@ harriscountytx.gov, and I will get back to you. The contact information will be repeated for you at the end of the public hearing. We would love to hear from you. At this time, please turn your attention to the co-chairs of the Quality Improvement Committee. First, Pete Rodriguez will explain the committee's function, followed by Tana Pradia, a 2014 graduate of Project LEAP, who will describe the committee's How to Best Meet the Need recommendations for 2024.
Thank you for the valuable information, Diane. Many current and former council members are graduates from Project LEAP and would agree that the training is very valuable for those who want to be involved in the planning process. The How to Best Meet the Need process is the focus of tonight's public hearing. Each of the Part A, Part B, and Texas Department of State Health Services funded service categories were reviewed during a series of work groups comprised of consumers, service providers, healthcare providers, and other community members. When reviewing the definition of each Ryan White funded service category, the work groups considered many facts, such as the documented need of various populations living with HIV in the greater Houston area, the history of service usage, epidemiological trends, and the availability of alternative resources, including both Ryan White and non-Ryan White funding. The work groups made recommendations, and the Quality Improvement Committee met to review and approve those recommendations. A copy of all service definitions, including recommendations from the work groups and Quality Improvement Committee, is available in the information packet, which is posted on our website, rwpchouston.org. All comments received from the community regarding the recommendations will be forwarded to the Quality Improvement Committee for consideration and added to the recommendations that will go to the Planning Council for the final approval next month. There are also 3 How to Best Meet the Needs special work groups that are continuing to meet. One is discussing the needs of individuals aging with HIV to determine how to improve services for this unique growing population. The second is looking at providing case management services for populations with very specific needs, including aging, youth, and more. A third work group will be held later this month in collaboration with the Serving the Incarcerated and Recently Released Partnership, commonly known as SIRR or SIR. This work group will address Goal 3C of Houston's 2022 Integrated HIV Prevention and Care Plan by reviewing data regarding issues related to people who are incarcerated and those who are recently released. Please check our website calendar for the dates and locations of these important work groups meetings, or you can call the Office of Support at 832-927-7926. I would also like to mention our use of the federal poverty guidelines as eligibility criteria for Ryan White services. The guidelines are evaluated annually during the How to Best Meet the Need process. For most services, the financial eligibility is set at 300% of the federal poverty level. The federal poverty guidelines for 2023 are as follows. For a single person, 300% of the federal poverty level is an annual income at or below $43,740. For a family of 2, 300% of the poverty level is $59,160. And for a family of 3, 300% of the poverty level is $74,580. For additional family members, add $5,140. The same increment applies to smaller family sizes and can be seen in the previous figures. According to the U.S. Department of Health and Human Services webpage, where the guidelines are located, they become effective on the day they are published. A copy of the 2023 Federal Poverty Guidelines is included in the information packet. At this time, my co-chair, Tana Pradia, will present the recommendations and describe changes to the service definitions for fiscal year 2024. Please note that the services discussed are for people who are living with HIV and meet the required eligibility guidelines.
Thank you, Pete. I will now present the recommended changes to the service definitions and eligibility guidelines for fiscal year 2024. The information packet for tonight, public hearing, includes a copy of each of the service category service definitions, along with the summary of recommended changes for all service categories. The current financial eligibility for each service, as well as the suggested financial eligibility for fiscal year 2024, is listed on the table of contents of the service definition packet. So first we have case management, medical, clinical, non-medical service linkage, and non-medical targeting, substance use disorder, hospice services, local pharmacy assistance program, LPAP, medical nutritional therapy supplements, mental health services, oral health, untargeted and targeted, the normal rural area, outreach, referral for healthcare, ADAP enrollment workers and incarcerated, substance abuse treatment, and vision care. The Quality Improvement Committee is recommending changes to the following services: ambulatory outpatient medical care, which includes emergency financial assistance, pharmacy assistance. Add text to the service definition for EFA pharmacy stating that within a single fiscal year, waivers can be submitted to the administrative agent requesting an extension of the 30-day time limit. If multiple waivers are required, they do not need to be submitted consequently. Keep the financial eligibility the same. Primary care, 300%. EFA pharmacy, 500%. Emergency financial assistance, other. Keep the service definition and financial eligibility the same at 400%, with the understanding that the Planning Council may add additional services based upon additional information, which is to be provided soon. Health insurance premium and cost sharing assistance. Keep the service definition and financial eligibility the same, 0 to 400%. ACA plans must have a subsidy and also request that the Integrated Plans HIV Education Council increase awareness of this service among private physicians. Logistics services. Keep the service definition the same and increase the financial eligibility to 500%. Also, explore ways to use virtual technology as much as possible to make this service more accessible and easier for consumers to use. And ask the Quality Improvement Committee to explore language justice principles in order to make all Ryan White funded services inclusive of people from all cultures. Transportation, add ride sharing to the service definition and keep the financial eligibility the same at 400%. For more information about these suggested changes, please contact the Office of Support at 832-927-7926. I will turn the floor back over to Skeet to explain how you can submit public comment regarding the information presented at tonight's public hearing.
Thank you, Tana. Pete, and special thanks to the Quality Improvement Committee and How to Best Meet the Need Work Group participants for the hard work they have put into this important process. After hearing the information presented this evening, you may want to give public comment to the Planning Council. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. There are several options for you to provide public comment to the Planning Council. You are not required to give your name or HIV status to do so. You can email comments to feedback@harriscountytexas.gov. You can also fax comments to 713-572-3740. You can phone in your comments to 832-927-7926, or you can send your comments through our Facebook page, RWPC Houston. Comments must be received by our office before 10 a.m. on Wednesday, May 24th. Comments will be forwarded to the Quality Improvement Committee for review and consideration. If significant comments related to the service categories are received, the Quality Improvement Committee, will meet virtually on May 24th to review the comments and consider making changes to the recommended service definitions. On June 1st and June 8th, the Steering Committee and Planning Council will review and vote on the fiscal year 2024 service definitions. You are welcome to attend any of these meetings, either virtually or in person. Please check our website calendar for meeting packets, location, and Zoom information. This concludes the first Ryan White Planning Council public hearing for 2023. I would like to thank everyone who viewed the program for participating in this important process. As stated earlier, the service category recommendations presented will not affect how services are delivered now, but will impact how services will be delivered approximately 10 months from now in the year 2024. The Ryan White Planning Council meets on the second Thursday of every month at noon in a hybrid format, which gives you the option of attending in person or virtually. Please check the calendar on our website, rwpchouston.org, for the location of council, committee, and work group meetings, meeting packets, and Zoom links. Staff is working remotely and in the process of relocating the Office of Support, so please call rather than come into the office if you need additional information. To apply for Project LEAP, the free training program which looks at the HIV prevention and care system in the greater Houston area, please go to our website, rwpchouston.org, for a link to submit the application online. Applications are due before July 7th. This is a wonderful learning experience, and I encourage everyone with an interest in HIV services to apply. Our next public hearing will be at 7:00 p.m. on Monday, June 26th. The topics to be presented will include the Priority and Allocation Committee's recommendations for the service category priority rankings and funding allocation for fiscal year 2024. On behalf of the Ryan White Planning Council, we thank you again for participating and have a good evening.